Jim.
Hey, Mike. What's up?
The car looks great. Nice work.
You want to help?
No. That wouldn't be a good idea. I just stopped by while Mary went for a walk.
Yeah, she called and asked Ellie to walk with her at the park.
Anyway, I saw this ad on TV and it got me to thinking. You know, we're getting to be that age. We got to start thinking about Medicare.
I know. How did that happen? Do you know anything about Medicare?
A little, but I certainly don't know enough about it at this point.
Agreed. I do think it's a good idea to choose a Medicare plan. And I have a friend who has a plan from Security Health Plan. He's very happy with his plan, and he loves that they're a local company.
Yeah.
Are you ready for Medicare? Talk about a tricky subject. Hi, I'm Brian Kelly for Security Health Plan. Over the next half hour, I'll help you gain a better understanding of Medicare in general. I'll talk about Security Health Plan's options for Medicare coverage, including Medicare Advantage, Medicare Supplement, and Medicare Medical Savings Account plans. Before we get to that, I bet some of you are wondering, what is Security Health Plan?
Security Health Plan is a not-for-profit insurance company that has been based in Marshfield for 50 years. But more than insurance, Security Health Plan has been a leader in supporting health for our members and communities. A recent example is the COVID-19 Community Support Fund, established jointly with the Marshfield Clinic Health System's Center for Community Health Advancement. We were the first health system in Wisconsin to establish a fund that provides financial resources to community organizations affected by the pandemic.
Now, this may be the first time you can enroll in a Medicare plan, or you might be thinking about switching your plan. But what is the right choice for your lifestyle and budget? Well, that's what I'm here to help you understand. I think you'll find that Security Health Plan has a Medicare plan that's right for you. Let's start by covering some Medicare basics.
Now, you said that your friend says that Security Health Plan really knows their stuff. Well, that's good, because I really don't know that much about Medicare.
Here's what I know. Medicare Part A is for when you go to the hospital. And Part B is for when you go to see the doctor. Parts A and B are known as Original Medicare. That's about it.
When you only have Original Medicare Parts A and B, you are responsible for the remainder of the costs for all these services, including large deductibles and coinsurance. And you should note that Medicare has no limits for how much you'll have to pay out of pocket in a year. There are also two more parts to Medicare, Part C and D. Medicare Part C is commonly known as Medicare Advantage. Medicare Advantage plans replace Original Medicare by covering Part A and Part B services. Your coverage and claims are handled by contracted third parties, like Security Health Plan. Medicare Advantage plans not only cover Parts A and B, but they go well beyond Original Medicare by offering additional services. For example, many of Security's Medicare Advantage plans include worldwide coverage for emergency and urgent care, routine dental, hearing, and eye exams, eyeglasses, hearing aids, and much, much more. Medicare Advantage plans simplify your life by combining all Medicare coverage under one plan. Finally, Medicare Part D is Medicare's prescription drug coverage. There are multiple ways to receive Part D coverage. For example, most of our Medicare Advantage plans include Part D coverage. Alternatively, you could purchase a standalone Part D drug plan to match with a supplement or Medicare Medical Savings Account plan. We'll go over all of this a little later.
It feels so good to be outside.
Yeah, it does. Thanks for asking me to go for a walk while Jim's at home working on his car. I swear he loves that car more than me. Do you know he named it Eleanor, for goodness sake?
Oh, well, I guess we will never fully understand men. You know, my Mike was going to stop over and see Jim today. He saw Medicare ad on TV, and now he's worried that he has to figure everything out. We are at that age, you know.
You're right. Jim and I have a friend that has a Medicare plan from Security Health Plan, and he's really excited about it. It has the SilverSneakers fitness program, and he gets to go to the gym with his friends and try any of the programs, and it's all free.
All of Security's Medicare Advantage plans except Secure Saver MSA include free SilverSneakers. Our members can take advantage of SilverSneakers fitness opportunities at many national and locally owned fitness centers. It's a great way to get together with your friends and get fit. And if you don't live near a participating fitness center, SilverSneakers offers a mobile fitness app and over 200 workout videos you can use all free. We also cover many more benefits for all of our Medicare Advantage HMO plan members.
At Security Health Plan, we're celebrating you. And you. 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 And you. By offering affordable Medicare plans with special perks just for you. Because we all want a Medicare plan that puts you first.
Medicare Parts A, B, and D help cover your costs for hospital stays, doctor visits, and prescription drugs. Straightforward, understandable. But Part C, Medicare Advantage, is quite a bit different. I'm thinking you might want to know more about Medicare Advantage.
I wonder when we have to sign up for Medicare. We're not really ready for all of this. Mike said he doesn't even want to think about this until after we turn 65.
I don't think you should procrastinate. My friend said there are several options when to enroll, but it's good to get started as soon as you can.
The first option is called your initial enrollment period. This is when you first become eligible for Medicare.
You have 3 months prior to and 3 months after your eligibility month to join a Medicare plan. For most people, your eligibility month is the month you turn 65. For example, if you turn 65 on April 14th, you can enroll in any of the 3 months prior to April, January, February, or March, during your birthday month of April, or during any of the 3 months following April, May, June, or July. In short, you have a 7-month window to enroll when you're enrolling in Medicare for the first time. Option 2. Each year after your initial enrollment, you'll have an annual enrollment period, or AEP. During this time, you can make changes to your Medicare Advantage coverage, add or drop coverage, or switch plans. This annual enrollment period runs from October 15th through December 7th. Option 3 is the Medicare Advantage Open Enrollment Period, or OEP. Once you have a Medicare Advantage plan, you can make a one-time move to another Medicare Advantage plan or Original Medicare from January 1st through March 31st each year. Finally, Option 4, a Special Enrollment Period, or SEP.
Now that we know when you can enroll in a Medicare Advantage plan, let's talk about the Medicare plans available in your area. Before we look at plan specifics, I should mention that Security Health Plan's Medicare plans are available only to residents of Wisconsin.
Okay, so there are plenty of chances to join a Medicare plan. If I'm going to take the plunge, I need to know more, a lot more about my choices.
Absolutely. There are a bunch of great choices of Medicare plans from Security Health Plan. You just have to call the sales associates and they'll help you find the plan that's right for you.
Let's start with our HMO point of service plans.
These are available in 3/4 of the state. If you live in one of the 55 counties in the orange area seen here, you have 6 options. Ascend RX with medical and prescription drug coverage, Essence RX with medical and prescription drug coverage, Essence with medical coverage only, Esteem RX with medical and prescription drug coverage, Spirit RX with medical and prescription drug coverage, and Spirit with medical coverage only. If you live in one of the 12 counties marked with a star and you qualify for both Medicare and Medicaid, you also have a cost-saving choice of our Ally RX dual-eligible special needs plan. We'll discuss this option in a few minutes. In addition to these Medicare Advantage plans, we also have our Secure Saver Medicare Medical Savings Account, or MSA plan, which is available statewide. We'll look into that plan in more detail shortly.
I know one of the biggest deals for me is I want to make sure I can keep seeing my doctors.
Our HMO point of service plans have an extensive network that includes thousands of doctors and healthcare professionals, convenient hospitals, and clinics in your region. Some of the largest, most well-known providers are shown on this map. However, one of the biggest advantages of Security's HMO point of service plans is that you have the option to use healthcare providers who are not in your network.
Generally, you will pay the same costs whether you use providers who are in your network or not in your network. However, for certain services, you may be responsible to obtain prior approval if you use a provider who is not in your network. If you use a provider who is in your network for those services, your provider will obtain prior approval for you. A big factor in your choice of plans is the cost of monthly premiums and what you will pay out of pocket when you use healthcare services. Every year, we look at how we can make plans better for our members, and this year is no different. With all of our Medicare Advantage HMO point-of-service plans for 2022, you'll pay nothing for the office visit for Medicare-covered services when you see your primary care provider. Your primary care provider can be family practice, internal medicine, OBGYN, a nurse practitioner, or a physician assistant. Let's look at the 6 Medicare Advantage HMO point-of-service plans. Esteem RX is a $0 premium plan that covers all your healthcare and prescription drugs. The annual maximum you could pay when you use healthcare is $5,000. 2 Essence plans have premiums of $18 per month for health coverage only and $88 per month for healthcare and prescription drug coverage. Essence plans have an annual maximum when you use healthcare of $3,400. Ascend RX covers all your healthcare and prescription drugs for a premium of $40 per month and an annual maximum when you use healthcare of $4,500. And our 2 Spirit plans have higher premiums, but you pay much less when you use healthcare and services. The Spirit premiums are $150 per month for health coverage only and $229 per month for healthcare and prescription drug coverage. Spirit plans have an annual maximum when you use healthcare of just $1,200. With all plans, you must continue to pay your Medicare Part B premium.
Hey, I just thought of something. I'll bet I spend way more on prescriptions than I do in the doctor's office. Way more.
You're not alone. I take a few meds too. Most of the plans my friend mentioned include drug coverage. Medicare makes it pretty affordable, even if you take a lot of medications.
Enrollment in Part D prescription drug coverage is voluntary, of course, and you can sign up whenever you like. However, late enrollment penalties may apply if you enroll in Medicare Advantage now and then sign up for your Part D plan later. So it's to your advantage to make it a part of your plan from the outset. If you have Medicare Advantage HMO point of service coverage, you must receive your Medicare Part D drug benefits through that plan. You cannot have a Medicare Advantage HMO point of service plan and a separate standalone Part D plan. If you enroll in a separate Part D plan while you are already a member of one of our plans, Medicare will disenroll you from your Security Health Plan coverage. You can, however, use prescription drug discount programs like Wisconsin Senior Care, TRICARE, or Veterans Affairs.
One significant benefit of Security Health Plan's Medicare Advantage HMO point-of-service plans with Part D coverage is you pay $0 for vaccines. That includes all Part D vaccines, such as the shingles vaccines, which can be very expensive without the plan. It also covers routine tetanus shots. Finally, you may be able to get help paying for your prescription drug premiums and costs. To see if you qualify to get extra help from Medicare, call 1-800-MEDICARE, the Social Security Administration, or the Wisconsin Department of Health Services.
That prescription coverage sounds great, but I suppose I'm more concerned about my medical needs and costs. I mean, what would I do if I had a heart attack or a stroke?
I know my friend wouldn't be with Security Health Plan if they didn't take care of his healthcare needs. He says Security covers everything they have to cover as a part of Medicare, plus a lot more.
The added benefits you get with Security's Medicare Advantage plans include free SilverSneakers fitness programs, cost savings on insulin, additional coverage for hearing, vision, and dental care, preventive health services at no cost to you, such as mammograms and colonoscopies, a $30 quarterly credit to buy over-the-counter health and wellness products from our mail-order catalog, convenient mail-order prescriptions, 2 weeks of meals delivered to the home of members with congestive heart failure after an inpatient hospital or skilled nursing facility stay, worldwide emergency and urgent care coverage, innovative ways to provide care for you when and where you need it, such as our 24-hour nurse line and Care My Way, which offers free, unlimited access to convenient care for common health conditions right over the phone. Telehealth services available with certain providers who offer advice and care by phone, online chat, interactive two-way video, or other means, and much more.
Let's dig a little deeper into our dental, hearing, and vision benefits.
For hearing benefits, we offer 1 hearing exam per year. You pay only a copayment for the exam of $15, $25, or $50, depending on your plan. We also offer huge cost savings toward the purchase of hearing aids. You pay only a $500 copayment for each hearing aid, up to 2 aids per calendar year. For vision benefits, you can get one free routine preventive eye exam per year. If you need a diagnostic eye exam for injury or illness, you pay only the copayment for your plan. We will also pay a stipend toward the purchase of eyeglasses for your routine vision correction needs of $135 or $175, depending on your plan. For dental care, we've partnered with Delta Dental to offer one free preventive exam per calendar year when you use a Delta Dental Medicare Advantage network dentist. You pay nothing for the exam, which includes a preventive cleaning and one set of bite wing x-rays. Once every 5 years, you can get the full mouth series or panoramic x-rays, also at no charge. And as a member of Security Health Plan, you have the option to purchase a supplemental dental plan for an additional premium of $43 per month. We've partnered with Delta Dental as well for this benefit. When purchased, this coverage is added to the preventive dental benefits that are standard with your Medicare Advantage plan. This coverage is subject to a $1,000 maximum annual benefit, and you must use a Delta Dental Medicare Advantage network dentist. If you choose this coverage, you pay nothing for one additional exam and cleaning per calendar year. You pay 20% of the cost for emergency treatment of pain and fluoride treatments. You pay a $100 deductible, then 50% of the cost for restorative care, fillings, root canals, crowns, gum disease, implants, dentures, oral surgery, and more. Please note that if you disenroll from your Medicare Advantage plan, your supplemental dental benefit will also end.
Before we move on, let's recap what we've learned about Security's Medicare Advantage HMO point of service plans. First, you can choose the plan that best fits your health and budget. And within your network, you can select from thousands of high-quality doctors, hospitals, and other healthcare professionals to make sure you receive first-rate care. You also have out-of-network coverage that lets you see any Medicare-certified provider in the United States that is not opted out of Medicare. You receive invaluable health services at no extra cost. These include Medicare-covered preventive services such as mammograms and colonoscopies, vaccines, and diabetes testing supplies. You also receive important services beyond what Medicare covers. And whenever you feel the need, you can talk free of charge with health professionals on our staff who will work with you to help you stay as healthy as possible and manage your chronic conditions. These include health coaches, registered nurse care managers, and social workers. Also, when you choose one of our Part D plans, you can get a free medication review from a pharmacist who will help you understand your prescriptions, make sure you're getting the best results, and keep your out-of-pocket costs down. You get the care you need without unexpected hassles. You don't have to be in the hospital for 3 days before you can receive care to recover from an illness or injury at a skilled nursing facility. In most situations, you pay nothing for self-administered medications you receive while in the hospital for an outpatient observation stay or emergency room setting. You have one less worry if you travel, because we will cover your emergency and urgent care anywhere in the world. Your costs are not based on your age or medical concerns. In other words, your premium won't increase because you get older or if you experience a medical condition. All members within each Medicare Advantage plan option pay the same monthly premium and have the same maximum annual out-of-pocket limit.
And finally, your calls will go to our friendly, award-winning customer service professionals and benefit specialists right here in Wisconsin, who will answer your questions and get you the help you need.
Now let's talk about something very interesting that Security Health Plan offers, Ally RX Dual Eligible Special Needs Plan, or Dsnip. This plan will save you money and provide more extensive health care support if you qualify for both Medicare and Medicaid. Ally RX members follow a coordinated care plan designed to provide specialized care and services to individuals with unique needs. These members receive the added value of a dedicated care team. Since members have full Medicaid coverage, Medicaid will pay Medicare premiums, deductibles, and cost sharing for covered services. In short, there's no premium and very limited co-payments from Medicaid for certain services and your prescription drugs. You must continue to pay your Medicare Part B premium unless it is paid for you by Medicaid or another third party.
Ally RX Dsnip is available in 12 counties: Barron, Chippewa, Clark, Eau Claire, Lincoln, Marathon, Oneida, Portage, Price, Rusk, Taylor, and Wood. For Ally RX members, we cover preventive dental, supplemental dental, over-the-counter wellness products, and free SilverSneakers fitness programs. Contact Security Health Plan for more details about Ally RX.
You know, Ellie, I'm enrolled in a health savings account, an HSA, and it really helps us save up the money we need for our health care. I wonder if there's something similar when you're on Medicare.
Actually, my friend was in the same situation with an HSA and said there is a similar Medicare plan that acts the same. It's actually an MSA, which is short for Medical Savings Account.
Here's how our Secure Saver MSA plan works.
Begin by enrolling in an MSA plan through Security. We'll work with a company called Optum Bank, member FDIC, to set up your MSA. Then you'll receive a welcome kit and a debit card for use on qualified medical expenses. Each year, Medicare through Security Health Plan deposits a fixed amount into your Optum Bank MSA.
When you visit your healthcare provider, you can pay from your own funds or use funds from your MSA to pay for those services. Once you've met your deductible, Security Health Plan will cover your costs until the end of the year.
In 2022, the Secure Saver MSA plan deductible will be $5,600. Medicare provides an initial deposit of $1,920, meaning the difference of $3,680 is your total out-of-pocket expense for the year.
Any money from your MSA that goes unspent rolls over to the next year, and you can use your Secure Saver funds for any qualified medical expense.
You get all this for a $0 monthly premium and no monthly maintenance costs. There are a few caveats. 1, you must continue to pay your Medicare Part B premium. 2, while you may use your MSA funds for non-Medicare costs, things like prescriptions, dental care, dentures, eye exams, hearing aids, cosmetic surgery, and more, only Medicare-covered expenses will count toward your deductible. 3, Secure Saver MSA does not cover prescription drugs.
If you join a Medicare MSA plan, you can also join any separate Medicare prescription drug plan. You can have a standalone Part D prescription drug plan or a plan such as Wisconsin Senior Care to help you pay for your prescriptions.
Finally, if you must disenroll for some reason, like moving away from Wisconsin, you will need to pay a prorated portion of the Medicare deposit back to the plan. And that's our Secure Saver MSA.
Let's talk about one more plan option that may be familiar to you, a Medicare Supplement.
You said your friend has a Medicare Advantage plan from Security Health. But I've got a friend who's got a Medicare Supplement. And he says for him, it's the way to go. I think his plan is from Security Health Plan too.
It probably is. My friend said Security offers a Medicare Supplement. He said that's what made his choice so hard, because all the options at Security are good. I've heard a supplement protects you from medical costs not covered by Medicare, just like Medicare Advantage plans.
With a supplement plan, you can see any Medicare certified provider in the United States that has not opted out of Medicare. You can also add riders to give yourself even more coverage. Let's dig deeper. These optional riders allow you to choose your premiums and out-of-pocket levels to fit your personal and financial needs. First up is the Part A deductible rider.
This rider protects you from Medicare's hospital deductible, which is currently $1,484 each benefit period. What's a benefit period? Here's an example. After you leave the hospital and have not received skilled nursing care for 60 straight days, that marks the beginning of a new benefit period. As you can see, it's possible you could have several of these benefit periods in a single year. Next, the Part B excess charges rider. This rider is valuable if you use a provider that does not accept Medicare assignment. We will pay the difference between what Medicare pays and what your provider charges. The additional home health care rider. This rider guarantees you will be covered for home health care for an aggregate of 365 visits per policy year as required by Wisconsin law. It adds some coverage for home health care that is not covered by Medicare. However, because Medicare pays for the majority of home health care services, this rider may not substantially broaden coverage. Then there's the foreign travel emergency rider. After you pay a $250 deductible, we will pay 80% for emergency medical care received outside of the U.S. Care must occur during the first 60 days of the trip, and there is a lifetime limit of $50,000. Finally, there's the Medicare Part B copayment or coinsurance rider. This rider is a little different. With all the other riders, you pay an additional premium to avoid charges. This rider is sort of the reverse of that. With it, you can reduce your premium by agreeing to pay some charges that your supplement policy would otherwise cover. Things like a $20 copayment for office visits or a $50 copayment for emergency room visits.
Why purchase a Medicare supplement?
1. Our $30 per quarter benefit for over-the-counter health products was extended this year for our Medicare Supplement members. 2. Unlike with an HMO, there's no provider network. See any Medicare certified provider in the U.S. that is not opted out of Medicare. 3. Competitive premiums. Plus, there's no application fee to apply for coverage. Medicare supplement premiums increase as you age, however, so we encourage you to shop your Medicare options every year. 4. Guaranteed availability. Our Medicare supplement is available to all Medicare-eligible Wisconsin residents, and once you have it, you cannot be canceled or charged more than anyone else your age because you develop costly health problems. 5. Unlimited preventive care. Medicare mandates free access to most preventive health care. Security Health Plan takes that a step further by paying 100% for most annual physicals, preventive tests, and services that are not covered by Medicare. And we don't put a cap on this benefit. Other plans commonly limit this benefit to $250 per year. Again, our purpose is to keep you healthy.
Those are all the Medicare plan options offered by Security Health Plan. I hope we've shown you today that we put our members first. We do that because we really do care. We're not some national company with a headquarters halfway around the country and call centers halfway around the world. We're local. We're right here in Wisconsin.
Your calls will go to our friendly, award-winning customer service professionals and benefit specialists right here in Wisconsin who will answer your questions and get you the help you need. When you call with questions, you'll speak to a real person in Wisconsin. Most of our employees are from here. This is our home. You are our neighbors, our friends, our family. Doing right by you is what we're all about.
Wow, Jim, you sure know a lot about Medicare. I'm glad I came over today. Thanks.
No problem, Mike. I'm going to give Security Health Plan a call. My friend says after you join Security, all you have to do is call their Medicare customer service team whenever you have a question about your coverage. Now, let's take this baby for a spin. The girls are still walking. We have plenty of time.
To sign up for Medicare coverage with Security Health Plan, simply call the number below or visit the website for more information.
Security Health Plan's Medicare plans are only available to Wisconsin residents. Our Medicare Advantage HMO point-of-service plans are available in 55 counties. Our Medicare MSA and Medicare Supplement plans are available everywhere in Wisconsin. Please check our website at www.securityhealth.org/Medicare-info or call our sales department at 1-877-909-1021 to find out exactly which plans are available in your county and to learn more. Thank you.